Well, my name is Ricardo Carapeto. Carapeto is a surname. It's difficult to see in Spanish, but it is a surname. I work in the 6.3 in antimicrobial stewardship in the environment, and my daily work is all about environment, medicines, and resistances. It's great to have you all here. There was another panelist we are still expecting to connect from the European Commission. Hopefully she will manage to do so while we are speaking. So as soon as she gets in, I will introduce her. But thank you all for being here. It's great to have a panel of this nature because it's very, very, very heterogeneous, the background of the people that is here. We have a civil engineer that is the one that is to be connected here. We have a physician, we have an environmental scientist, we have 2 lawyers. Could you imagine who is who? You think that?
Try to guess.
Try to guess. The lawyers are always easy to see that. No, yeah. Thank you all. I think you will all give us a very nice perspective about the topic, and I will briefly introduce you, starting with you, Pablo. Pablo is one of the lawyers. He's a One Health specialist. Sorry, but I don't see very well. Because I'm getting old. One Health specialist at the United Nations Environmental Program in the region of Europe and Central Asia, is it okay? And he is specialized in One Health, as his position says, and he gives support to the quadripartite in the European region. We also have Ignacio Álvarez Serrano. He's the other lawyer, as you could imagine. Ignacio has a degree on law and business, and he has been working as a lawyer in the field of environment and residues, which is a very specialized field for working, and that specialization took him to be the head, that is his actual work, the head of legal affairs in SIGRE, that is the national organization leading with their unused medicines. So thank you very much for coming. Next to him we have Caroline Whalley. She is the environmental scientist. She's working in the European Environmental Agency, Copenhagen, in the unit of freshwater and marine unit. And we have collaborated in the past in AMR surveillance, etc. That is a field where the environmental agency is growing faster and faster. So thank you very much also for coming. And last but not least, you also know him because he has been already in the panel. We have here Diamantis. Plachouras. So, yeah, thank you. Well, you know. Yeah. He works in ECDC and in the AMR topics and healthcare-related infections, and he has been working for almost 15 years there in surveillance and development of guidelines. So thank you all for being here. As soon as Trudy Higgins, that is the colleague from the Commission connects, if somebody can throw me something because I cannot see you. Ah, she's there. Oh, great. Okay. Okay. Oh, Trudy, yeah. Vision is always above us. Very good to see you. Very good to see you, Trudy. And Trudy Higgins is our last panelist. She is the civil engineer working in the European Commission. She works in DG Environment in the unit of marine and environmental clean water. And she's, for her career, she has always been working in things related to water floods, store water, fresh water, drinking water, any work where water was mentioned, Trudy was there. So it's really good to have your expertise, because now she is involved in the implementation of the directive of urban wastewater that was adopted like 1 year ago, something like that. So thank you all for being here. And I have here a list of questions that we have discussed before, but before going to that, I wanted to make a brief explanation because we are going to discuss here now about antimicrobial stewardship and surveillance, okay? In stewardship, what we have been down in JAMRAI was as environment is one step or several steps behind humans and vets. Probably we thought that it would be better to start making kind of training to people that is related to the stewardship of antimicrobials in the environments, because probably many of them are not really aware of the health problem that is linked to the residues of antimicrobials. Antimicrobial stewardship is a definition that is still to be found, and we are working on that, but widely and only for the purpose of this panel, we can understand stewardship as anything that reduces the emission of residues of antibiotics to the environment, okay? So just to clarify that. So in your view, and I wanted to start with Ignacio because of your background, which are the most urgent, important need in antimicrobial stewardship, or what do you think is still uncovered in stewardship? Yep.
Okay, thank you very much for the invitation to participate. First of all, I want to explain that SIGRE is an extended producer responsibility scheme of waste medicine in Spain. So our mission is to duly guarantee that every waste medicine is duly managed from an environmental point of view. And we have identified we can call it gaps or emergency needs that maybe EU-JAMRAI can help us to implement. First of all of us know that all the medicines, not all of them, but some of them, like antibiotics, they contain AEMPS substances that, if they are not properly disposed of when they reach the end of their life, the environment can have this impact of these AEMPS substances, such as soil, groundwater, or surface water. So it is important to this sense to ensure duly management of both, as Ricardo has said, unused and expired medicines in the 3-generation main points that we have identified: the industry, hospitals, and obviously at home. It is very important. This strategy must involve all the agents in this workflow. I mean, from generators of this waste, patients, technicians in health sectors, and obviously the waste managers. They have to apply best practices, the best ones, the best standards, in order to avoid these kind of substances reaching the natural environment, both urban and natural also. And obviously the public authorities. In case of SIGRE, for example, we have worked very closely with the Spanish Agency of Medicines in this sense, and their support has been very important for us to communicate the importance of guarantee the management of this waste, because it is not a normal waste. It cannot be treated as normal waste. So it's important, for example, in the case of management, our system avoids, we engage managers to avoid these substances to reach landfills. We are not allowed landfill deposit because there is a minimum risk that this kind of substance reach the environment. So we take it very serious to our mission. So. And the other second maybe topic that we have identified is a lack of legislation. I mean, we are lacking of at a EU level framework legislation regarding the management of waste medicines. There is a lot of legislation regarding medicines, a lot of legislation regarding waste, but not waste medicines, and they are very specific. So I think it would be a very nice point of view to have into account in other, I don't know, the meetings or debates, because it's important as well to get all the agents in this flow be part of this strategy, and I think that's everything from my side. Thank you.
No, it's a very nice introduction to the thing, and a very nice point the one that you made with the health residues, because it is true that we haven't, we don't usually think about that, assuming that everything is under control in the hospitals. But it's good to know that it's something maybe to track and to follow. How is it done? And if there's a need of making something in cooperation. Thank you. If any of you have something to add on the emission of residues to the environment, the things that you think should be covered, just go ahead. I don't know if Caroline or Pablo, you want to add something?
Do you want to go ahead? I can maybe try to add something. Yeah. So first of all, as Ignacio said, I'm here representing UNEP, which is the environmental authority globally, and yes, we're part of the quadripartite as well, and we're now working obviously on AMR with a stronger mandate, especially after our UNEA resolution this last year that gave us that mandate to fully engage in AMR work. With regards of, on the question and on stewardship, maybe to take it a bit from a broader perspective than what Ignacio was saying. I think, and it's been mentioned right throughout the days, that we're still lacking that cross-sectoral collaboration and that cross-sectoral integration. So that's a first limitation, I think, in the perspective that maybe that could bring to working on antimicrobial stewardship. There are indeed uneven regulatory frameworks when addressing antimicrobial pollution through the full cycle. So this is design, production, use, disposal, and also waste treatment. So kind of highlighting that as well. There are gaps in treatment, in the prevention, in the enforcement as well. So I think that's something that we have to look at, also linked to the regulation aspect. And tying it to probably the next topic that we'll talk about, I think there's still limited surveillance as well, still to fully understand the trends, right, and the risks to be able to define also interventions in terms of the stewardship. So maybe just to take it from a broader perspective.
Yeah. No, thank you. Thank you very much. And Caroline, I don't know if you have a view or something you want to share with us. I don't want to put you in a difficult position, but just in case.
Well, maybe I should just explain. So I'm from the European Environment Agency, and our role is not as regulator. We're here to gather science and information about the environment, to help policymakers, to help our countries, and we are duly informed. It's a cycle of information. And what I was going to say is this is exactly the sort of question that makes people like me feel in the headlights. I am literally in the headlights right now, but it's, you know, when I think about AMR and the environment, there's rather little knowledge in the field at all about AMR, okay, because it's not been part of the remit until very recently in the EU. And so I like to paddle a kayak, a little boat, you know, I'm quite vulnerable to the waves. And when I look at the AMR and meetings like this, it's like that's that oil tanker and it's coming right on me, right? And I've been in this game for a while, a few years now, thinking about it, trying to learn about it, and I know you're all trying to help me, but you come with all the background and all this fantastic work and, you know, the kind of details that we've been talking about this morning. It's details. I'm sorry, it's not a detail, but, you know, I mean, we're starting from zero knowledge in AMR, basically. There's a bit now in the countries because of the revised water legislation, but really very little knowledge. So that the stewardship, you know, and all this, it's help the environmental colleagues, all right? And when we start talking about common things, so IPC, that's the pollution, I understand pollution control. I can talk to you about pollution control, you know, but actually in the water area, we rely on that upstream prevention, all right? And what we feel in the water is like where it didn't work, okay? So the monitoring there is where it didn't work. And there is actually a bit on terms of concentrations of chemicals under the Water Framework Directive. There's a bit of chemicals that countries need to monitor, pharmaceuticals. And that's because they're toxic to or via the aquatic environment. So there are some substances that are becoming priority substances or being monitored because of the toxicity to or via the aquatic environment. Now, AMR, there's potential there for it to come into under the watch list, under the revised Water Framework Directive, as an indicator, because we don't know what to do with the data yet. But my plea really is help the water managers now beginning to realise there's something in it. I'm sure they'll be very sympathetic if they understand what it is, how they can help, why they need to be involved, because it's another thing to monitor. We heard from the nurses how complicated everything is. This is a brand new topic to most water managers. So there's a whole bunch of stuff around, you know, and then I'm thinking, stewardship. what's this term? So, but it's not because it's not people aren't willing, but the whole language and all that concept we need to think about. Sit down with regulators, understand where and managers, what's the common ground, because there is common ground, but it's getting into a language that people can. Yeah, that's me. I can help there.
Yeah, no, and I fully understand your perception. That was also my perception when I was approached. But I have to say that you have a PhD in environmental chemistry, and that is really important for stewardship. Understanding how do antibiotics behave in the environment, if there are sinks, if they are degraded, all that kind of stuff. Is also the knowledge of a chemist is also very valuable. So there are always points that you can find. We need a lot of knowledge from everywhere. So don't feel overwhelmed by these guys. You know a lot from other fields that are very important for us. So thank you very much. I had another question. Moving now to the surveillance part. Just to mention briefly. For surveillance in the environment, we intend to run a pilot where other colleagues in other work packages are working on that. It is a complex issue, because going there and taking samples and analyzing samples is not difficult at all. But the purpose of the surveillance and what do you look for, what the frequency, the places where you take the samples, all those issues are really challenging. And one of the questions that we make ourselves several times about the surveillance in the environment is like which is the main purpose of the environmental surveillance. And here I will give you two options. None of them are strictly true. I just wanted to see your view from your position and your expertise, which would be more valuable for you. One of them, of the purpose of the environmental surveillance, could be like checking the situation of the human health, like we did in the COVID, like using wastewater for checking in a given population what is in there. And the other purpose would be something wider, like going to the different parts of the environment, trying to understand the trends of the emitted resistances, the dynamics and the interactions between the different environmental compartments, between humans and animals and the environment, etc. From those two potential uses of the surveillance, what do you think of each one of them? And same thing, looking to Diamantis, I will start with you, and then maybe with Trudy online. Thank you.
Sure, thank you very much, Ricardo. I think these are key questions, and I would start from saying that we need to look at the research questions or public health questions that we are asking surveillance to answer for us. And these two options you mentioned have two completely different purposes. So the purpose of surveillance in environmental samples has mostly the purpose to identify risks from exposure to these, for example, in surface waters, right? While surveillance in wastewater has mostly a different public health purpose to probably monitor the spread or monitor the trends in surveillance in the population that is, behind this wastewater that is analyzed, right? So, but this is not. So, depending on what question we want to answer, we need to look at the particular approach. But I mean, this is not enough, right? As Caroline said, we have very little knowledge about the contribution of the environment and how AMR in human-animal populations and the environment interacts. So we need definitely to fill in some knowledge gaps. And of course, surveillance can give us information, can give us scientific evidence and data. But usually for knowledge generation, research is probably better. So, but definitely I think it's a big opportunity now with all of us sitting together. We heard previously about the interagency working group. So it's a great opportunity to see what are the capabilities, what we can do in terms of using data from the environment to inform our work. And we're sitting together and we're learning from each other, I think, a lot. I've been learning a lot recently about what is possible. And so we start crystallizing a bit what real questions we can answer. But then I will move one step further and say that even if we collect the data and we analyze the data, and there are a number of challenges there too, we're not sure yet, what are the targets that we should be looking at, right? What are the methods that we will use to analyze these samples? Then we need to answer the question, what action we can take when we get these results, right? So, and I think this is a very important question. And this is very relevant for wastewater surveillance, because wastewater surveillance is actually a great opportunity, especially now with the new urban wastewater directive. It's a great opportunity to look more in depth into this. And wastewater surveillance has been used, for example, during the COVID pandemic. We all know about that with a lot of success, and giving us additional information on top of what we were getting, especially in cases where there was little testing in the human population, and we could forecast through using wastewater surveillance, and we would also find new variants and monitor the genetic evolution of the virus. And we also have other very strong cases where wastewater surveillance gives us actionable data, like with identifying, for example, in Europe, vaccine-derived poliovirus, where we know that in this case it makes sense to have a campaign. But for AMR, we're not there yet. We need to, of course, we know, what we know is that what are our primary critical priority pathogens in Europe, and these are currently carbapenem-resistant gram-negative bacteria and also ESBL-producing E. coli. And wastewater surveillance can monitor these types of bacteria, and probably they are valid targets. Now we still need to decide what are we going to be using. Are we going to be culturing for these bacteria, or are we going to be using genomic methodology to monitor? And there are pros and cons for these. So ECDC published in December a framework for wastewater surveillance in public health, where we set out some principles on how to approach wastewater surveillance for public health, looking both at the feasibility and the public health value. And when looking for the public health value, the added value, we need to, on the one hand, I think it's very important to correlate what we find from wastewater surveillance, for example, and probably also from surveillance samples in other environmental sources, with what we see in the human and animal populations, to make sure that what we are to understand how to interpret basically the data, because I don't think we're there yet. But we will get there, I suppose, very soon.
No, I'm sure we will. I'm sure we will. No, thank you very much. It was a long intervention, but very. But you gave us a lot of very valuable information.
On,
I know. No, we were talking on the phone, and he could carry on for hours. Yeah. Trudy, I haven't forgotten about you, and I would like to hear your views on that. Which, in your view, should or could, or which would be the pros and cons of those different two approaches for environmental surveillance?
Yes, I hope you can hear me loud and clear. And
yep, perfect. Yep,
just to say thanks for the invitation. Very happy to participate in this important work. And just to let people know that I work on the policy area of the Urban Wastewater Treatment Directive, and now we're currently passed the
Give us a second, the sound is gone. I don't know if it's from Trudy's side. I can hear myself, so I guess it is from Trudy's side. From her side, okay. I don't know if up there somebody can handle this while we keep on with the other panelists. Sorry, Trudy. Maybe somebody can give you some help. Okay, not to stop this. Maybe Caroline, if you can give us your view on this.
Yeah, well, it's which is your favourite child? So very fortunately, Diamantis has given us a great sort of side from the public health, the public health interest. For me, I'm very interested in wastewater treatment. Trudy leads the policy area, but for AMR and the wastewater, that's where I'm very interested in my role. Anyway, actually not just in my role. And I think there's an opportunity. So right now, because of the revised Urban Wastewater Treatment Directive, there's beginning to be a rollout of upgrade in Europe's infrastructure in wastewater treatment. So the last directive was 1991, and that led to a major upgrade of Europe's treatment for wastewater. 2024, and now we've got a new directive, and that runs to 2045 for countries to upgrade their wastewater treatment plants. So that's, at the moment, it's 25,000 plants that are in scope of the directive. It's going to go up to 50,000. We're going to learn lots about AMR and things. So are wastewater treatment plants important in in discharging AMR-resistant genes? We know they are, but they're very good at treating it, so we need that wastewater treatment. But then, is there a transmission risk back to humans? Because if there is, through the environment, through the discharges, if there is, then that changes the game about what needs to happen in the wastewater treatment plants. But we don't have that evidence yet. We don't know. Okay, there's no requirement at European level to have this, because we don't know. We don't have any evidence to say it's needed, that different sort of treatment's needed or anything. We don't know. So I was talking to Heike in the break, and this is something that JAMRAI can help with. Maybe have a look at, just see what's coming out of the plants, and is there something, what could be the risk. So this is about understanding better the risk presented. It's quite timely, I would say urgent in my book, because if there's only when you've got investment cycles, there's an opportunity, and we've got an opportunity now.
Okay. No, thank you very much. And the last, I'd like to hear Pablo's view. Yeah.
Okay. Yeah. Okay, it's working. Going a little bit further back to the question between what type of surveillance we should be doing. I mean, we mentioned, and in the conversations these days, there's a lot about, do we have to look at hotspots, or do we have to go a bit broader in terms of surveillance? I think doing surveillance at hotspots is going to be very, very important, obviously, because we have that concentrated antimicrobials and resistant organisms. These seems to be very practical entry points for surveillance and intervention. From the global perspective, what we're seeing, though, is that that's not going to capture the full picture of environmental AMR. And it's not going to have us understand risk, exposure, and long-term dynamics, right? So surveillance has to go maybe a bit broader, or maybe we need a tiered approach to surveillance as well. Maybe we can look into hotspots for efficiency or actionability, right, to start to move forward. But potentially embed this in wider monitoring and in a wider framework, right, to ensure that environmental relevance and policy usefulness in the end. From UNEP's perspective and maybe from the quadripartite perspective as well, we recently got the mandate to contribute to science and risk-based environmental surveillance, feeding relevant data, and I'm reading literally, into the quadripartite global integrated system for surveillance on AMR, and use that my colleague Dora mentioned, this GISA platform. What we're going to do and where we're going to start, and again, this is very preliminary work, is that we're starting with consultations of experts globally around this. So again, this is still work to be developed, and tying it a little bit in what JAMRAI could help on this. I think, as we've been saying before, the EU is always a best practice example for us. So in that sense, providing also that evidence to us that we can later feed into these systems, I think is going to be something that will be key to steer then intervention, of course. But what we want to ensure is that we have something that's realistic, that's sustainable, and that speaks to all of us, that is actually universal. So that's our global perspective as well.
Okay. No, very good to know. We will talk later about that. Later once we have finished, because we only have 7 minutes remaining. And I wanted to go back to Trudy. I don't know if you... Not yet. Oh, that's a pity. Okay. Okay, then we will go to another question. She's okay. She's back. Trudy, can you hear us? Just a second.
I can hear you.
Yeah, we can hear you now. Go ahead.
Great. Fantastic. Sorry about all of this. I don't know. Okay, so just reminding myself of the question, which was, which I think was whether the surveillance or AMR monitoring is for human health or really for environmental purposes or for both. And as I was saying, I'm working on the implementation of the new recast directive. So going back, this originated back in 2021, 2022, and through negotiations with the member states and others, we realised, as I've heard other fellow panellists say, that there's a lot of knowledge gaps still. There's a lot to be learned, and so the purpose in the Urban Wastewater Treatment Directive is quite clear. We have a recital in the directive that says we want to do the monitoring now to increase the knowledge on the main sources of AMR, and to further develop our scientific knowledge, and then potentially in the future take action. So we're not doing something now. We have other requirements in the directive where we do a lot of other types of monitoring on things like nutrients or BOD, and if we see that the levels are too high, above a certain level, there is an action required. So this type of monitoring is quite different and what's happening now in the directive is there is a requirement at EU level, so that we're putting in place secondary legislation where there will be an implementing act in terms of a harmonised methodology across the EU for monitoring AMR in urban wastewater, and we'll also be looking at, as well as the methodology, at an appropriate frequency based on our drivers. So we've done a lot of work with our colleagues in the Commission in the JRC. We've been doing a lot of work in 2025 through our expert group and with experts on discussing what would a way forward. And that work is ongoing still, but like we do understand that AMR monitoring can contribute to assessing risks in terms of circulation in the human population. What's coming into the wastewater treatment plant can be measured. We can look at trends and early warning, and perhaps even look at emerging forms of resistance. Again, what's coming into the treatment plant. We probably need to understand what different types of wastewater treatment plant can do. They're not all the same thing. It can be a bit of a black box. And also then to understand what happens downstream when we discharge treated wastewater into the environment, both in terms of replication in the environment and even, what might happen in terms of further possible transmission. So it's a good starting point. The directive will have member states reporting on this methodology by 2030, and we'll be working with Caroline and her team in the EEA on that reporting. And I think maybe that's just a place to start to make sure we all have from our point of view at the Commission. Thank you.
No, thank you, Trudy. We were laughing because somebody was sending me messages to telling me to sit down properly that you couldn't see. That's why we were smiling. Thank you, Trudy, for giving this very valuable information, knowing that the surveillance of antimicrobial resistance that is foreseen in the directive is more, if I understood you correctly, to gather data and to expand knowledge about what is happening there, rather to take actions. So you basically want to know what is happening there before and understanding it before making anything. Am I right in my understanding?
Yeah. So, just to be clear, this directive is come into application next year for member states. But what we have in the directive is an evaluation period. So in 2033 and later, we will evaluate, what we've learned from the data collected to date in many areas, including this area. So in time, there could be further developments in terms of AMR monitoring, which is just regarding Article 17, Part 3 of the recast Urban Wastewater Treatment Directive. It's a very specific requirement, and we'll take it from there. Yeah.
Okay, thank you very much. Look up to the camera, Ricardo. Which camera? It's over there. Okay, oh, sorry. I'm so bad with this. Now I'm lost. Very last question, because we have 2 minutes, and I would like to hear the views of all of you. And I will start with Ignacio, because I wanted to know, we always have like that, we don't really know when we have to do something at European level, if we should do it compulsory and in the same way for all the countries at the same time, a regulation or whatever, or be more flexible and try to foster action from the member states, trying to do something in voluntary scale, and maybe with less harmonization at European level, but with less harmonization at European level, but go ahead, Ignacio.
But more flexibility, maybe.
Yeah, go ahead.
Okay, from our experience, we have worked very closely, as I've said, with the Spanish Medicine Agency. So that results into flexibility, simplicity, and for example, we have defined this information to be included in the leaflet in the package leaflet, regarding duly management of waste medicines. We also have the support of the agency regarding those industrial pharmaceutical industry that place medicines in the market, the Spanish market. They have to participate in a collection system like SIGRE, for example. But obviously, AMR is a public health risk, and it's important to widen the territorial scope, I guess. The problem here is, as I've said, the challenge. The challenge in this task to meet is to have a unique legislation, a framework legislation regarding all the requirements that this kind of substances has to be applied in order to manage correctly from an environmental point of view. So I think that's if we continue with member state legislation, there will be for sure legislative barriers, and that would be maybe can jeopardize our efforts in that sense.
Okay, as we are running out of time, can you give us an answer in 10 seconds? Can you try? Yeah, go ahead. What was the second again? Sorry. If you think it's better, which is the pros and cons of harmonization via...
Of course, if you impose, we've got both really, because we've got the EU legislation on water that's coming through. So Trudy mentioned the information that's coming through under an implementing act in the summer for wastewater treatment. That will guide and that will drive innovation and capability building in the EU. But in Europe, at our European Environment Agency, we have our network of countries. It's called the IONET, and we're able to do things voluntarily and build capability, as well as use the experts in the country and it's a voluntary activity. So you can have push and pull, and those are both valuable, especially in such an emerging and rapidly developing area.
Okay, thank you.
Well, in human health, we are used to more voluntary at the EU level, more voluntary and consensus approaches because of there is the principle of subsidiarity. So I think, and I cannot say much more about that. What I want to say is that for EU-JAMRAI, it's great that there is a planned pilot for surveillance, and that will hopefully help us fill in some of the gaps that are there. So we're looking forward, and we're really grateful for this work, and also grateful for bringing us all together here, because this is very important. Thank you.
Okay, Pablo.
Yeah, not much more to add from UNEP's perspective. More than I mean, it's always going to be up to the EU and to the member states. but maybe just to pinpoint that there is an urgency, so that has to be taken into account.
Yeah. Yeah, you're also right. And although we are out of time, Commission is paying us, JAMRAI, I mean, so Trudy, go ahead and take as much time as you'd like to. No, I'm kidding. Only 10 seconds, Trudy, thank you.
Won't waste, I won't destroy your lunch hour. Yeah, so in terms of a harmonised approach or national surveillance, like from the EU's point of view, the harmonisation provides the ability to compare data. You know, AMR knows no borders, so we can, you know, it facilitates better approaches in different regions or localities. And also by providing this harmonised implementation, you know, depending on member states' current capabilities, you know, it can help reduce the burden on them, on individual authorities. But obviously, there are always national or local pressures that need to be understood. So, you know, from my point of view, both are probably needed, and both can be effective together. Yeah. Thank you.
No, thank you. And with that, we are already out of time, so thank you very much. It's been a pleasure having you there. We already have our contacts. We will keep in touch for our work, and you just call us if you need us, anything from us. Thank you very much. Thank you.